2024 has been met with a lot of respiratory illnesses being called a triple threat. Kentucky is not along in reporting high or very high levels of the flu, COVID, and RSV.
Well, since the holidays, the CDC has been tracking these high levels of respiratory illnesses now being seen in at least 35 states. Here's ABC's Melissa Adan reporting from Los Angeles.
While the winter holidays may be behind us, a triple threat in respiratory illnesses remain. New CDC data is tracking at least 35 states experiencing high or very high levels of respiratory illnesses, with the South reporting the highest levels. These spikes can strain emergency rooms, and COVID hospitalizations are still slightly growing week by week for the last 2 months, with some slowing to flu hospitalizations.
What's really critical right now is that the world understands that COVID, the public health risk from COVID remains high, and this is globally.
And it's not just in the U.S. Researchers at the World Health Organization say that the actual circulation of COVID around the globe is anywhere between 2 and 19 times higher than what is being reported. This due to testing found in wastewater.
While we're not in the crisis, we're not seeing the levels of impact that we saw in the peak of the pandemic in 2021, 2022, and even early 2023. COVID is still a global health threat, and it's causing far too much burden when we can prevent it.
Cases of RSV are still on the rise in many parts of the country. It is starting to drop in some parts, but infants and children under 4 are hospitalized with RSV more than any other age group, which is why doctors recommend RSV vaccines for babies under 8 months, pregnant women, and adults who are 60 years or older.
As for vaccination rates, they are lagging. According to the CDC, only 19% of adults have gotten an update in their COVID vaccine this year, and nearly 47% of adults have gotten their flu shot. This as doctors urge people to stay up to date with their vaccines. Melissa Adan, ABC News, Los Angeles.